Get an inside look at the medical field and discover the unexpected challenges and rewards of working as a doctor in my 1 year journey. It's been a whirlwind of emotions, but I've learned so much I want to share with you. Let's dive in. First, let me give you some background on my journey. I'm Dr. Yazdan Beg, currently working as an intern doctor in South Africa. I have just recently completed my first year of internship, and over the course of last year, I have rotated through general surgery, internal medicine, pediatrics, and obstetrics and gynecology. Contrary to popular belief that every day in a doctor's life is unique, much of what we do is actually ends up just being the same thing. But on the few occasions that it isn't the same now, that's where most of the learning happens. It's true that you pick up majority of your medical knowledge on the day-to-day basis, but it's those few experiences that shaped how I view and practice medicine. Now this happened during my first month of working in surgery, general surgery. So the interns managed SOC, Surgeon on Call, or ED as you can call it, and most of the time we were unsupervised. So it's to be expected that things can go wrong and go wrong very quickly. A patient had just come to ED and we saw the patient, and at first glance, the patient didn't look too good in my opinion. I just had a gut feeling that something was going to go wrong with her. Even though her vitals recorded normally and she was awake and alert, something just didn't feel right. So I kept my eye on her in between the other patients that I was seeing. I would always just take a glance at her just to make sure that she was fine. So an hour or so passes and I notice that her pattern of breathing has changed. She starts to breathe fast. I quickly run to her and start to examine her. I ask her a few questions and notice that she's confused. I immediately called my seniors and started resuscitation. So by the time that my seniors actually got down, we noticed that she was gasping for breaths and we started chest compression soon after. Unfortunately, even after 30 minutes of CPR, we were unable to bring her back. This taught me a very important lesson early on in my internship, and that is to trust your gut feeling and to act on it. Keep an eye out for those that you suspect will deteriorate, because oftentimes they will deteriorate. After the incident, I had a few other times where similar incidents to this happened, and I always acted early and called my seniors and started resuscitations. The outcomes may not always be positive, but you know that at least you tried your best. The second thing that I learned was not to panic in dire times, like when I'm alone and an emergency arrives. If you lose your cool, you will forget whatever you've learned. So when I see that an emergency has arrived, I always just take a step back, take a few seconds to regroup, to make sure that I'm not panicking, and then I proceed. Having that little moment of clarity can bring a drastic change to how you approach the problem. Always remember that no problem is too hard to overcome. Just with a moment's break, you are able to analyze the problem well and to plan for that problem better. Working in these conditions and an unforgiving environment can take a hit on our mental state and also have an emotional toll. One prominent story that I have about this is during the time when I was working in pediatrics. I had a 13-year-old boy, I think, and the boy had just been admitted due to a leg mass. I saw that boy every day and we had a very good relationship. I would always go and talk to him whenever I see him. I was there from the moment he came to the hospital, and then he was diagnosed with osteosarcoma, bone cancer. I always suspected that that was the case, but the confirmed diagnosis weighed heavily on my mind. The shock looked on the parents' face when I told them about the son's condition, their anger, their frustration, and the look of sadness and being defeated. I saw it all. People don't always understand the mental toll that medicine can take. It can break you and remake you into a new mold. The biggest problem that we face as doctors is that even though there's so much trauma that we see and face, we don't deal with it well. We don't have debriefings most of the time. This leads to a buildup of emotions and stress which can stay with you for weeks, if not longer. This isn't like your everyday job where you can leave work at work. Incidents like this come home with you and stick with you for a long time. They can slowly chip away at your mental health if you don't have measures in place to keep your sanity and humanity. Some other problems that I have had to face that add up to all of these troubles are the overtime hours worked. I'm currently working 80 plus hours overtime per month. So these are the hours on top of the normal 8 to 4 that I work for 5 days a week. Oftentimes you feel burnt out. You need to have an outlet of outside of medicine to help you cope, like going out with your friends, playing sports, or reading, anything that you basically enjoy. Second, the lack of hospital staff and equipment. I spend a few hours each day working as a porter to take my patients to X-ray every day. I might have to go to different wards to get medical forms like discharge summaries, or to different wards to get IV cannulas. All of this isn't a doctor's job, but I have to do it to get my work done. I don't want this video just to be about me ranting about being a doctor. So as such, this line of work isn't all doom and gloom. It is also one of the most rewarding times to see a patient that has been with you walking out of the hospital after being treated. I know this personally, as when a patient came up to me when he was discharged and told me that he appreciates all that I had done for him and that I was one of the few people that cared about him there. He also went on to say that God should bless me for all that I was doing. That day, I went home with a warm heart, and I knew that I was making a difference in helping people. Moments of true appreciation are rare, and when they do come by, we should treasure them, as they are what keeps us going. When we see the look of happiness and relief when you tell a mother that a child is being discharged and that everything is okay, instances such as these are unique to our profession. These moments are what I find truly precious. They help me to maintain my humanity and keep me sane. That's one of the reasons why, besides the grueling hours and the harsh work environment, that I'm able to get up every morning and go and try my best at work. Now, let's move on to some other things that I have learned. Better communication skills, as it's essential to be able to discuss and relay matters of importance to your patients, colleagues, seniors, or the relatives of the patients. Time management, as oftentimes you have to prioritize what's the most emergency task and how you're going to go about doing everything in the most time efficient manner. Because if you don't do this, things can be missed and they often slip through the cracks. Dealing with stressful situations. I have developed my own system on how to remain calm and manage these situations without having worry and anxiety taking control of my actions. I feel that as doctors, this is one of the most essential skills we need to possess. Finally, I want to remind everyone that becoming a doctor is not just a job. It's a calling. It's a challenging but rewarding journey that requires dedication, compassion, and willingness to learn and grow. If you're thinking about becoming a doctor, my advice to you is to be prepared for the challenges, but also enjoy the moments of joy and triumph. I hope you've enjoyed hearing about my experiences as a doctor. If you have any questions or comments, please feel free to leave them below. Thank you for watching, and I'll see you in my next video.